All right. Good morning, folks. My name is John Decker, and it is 11:03 a.m. on Friday, and we're doing our Coffee with Community Services here. And let me introduce some Alta California Regional Center staff that we have with us today. First and foremost, my assistant, Zach, who is here. There we go. And we have our Community Services Manager, Olivia. And we have one of our specialists, Kate. And we've got Dan Kilmer, another one of our specialists, and Tracy Brown, one of our Associate Client Services Directors, and Shirley, who I always say is responsible for very many of your vendorizations as a Community Services Specialist, and then Gino Nessi, another one of our Community Services Managers. I do see that we've got Hewitt on here, our Emergency Coordinator as well, and probably a few more folks that will turn their cameras on or let themselves be known shortly. So we are going to go over a few different things today here at the Old Regional Center. As mentioned, we are recording this meeting. And with that being said, we have worked it out so that we are going to start posting the recordings of these meetings on YouTube, and we will have a link on our website in the service providers section that will allow you guys to access the previous week's recordings. And so the goal is going to be, yes, so I certainly appreciate so many of you that email me every single week asking me this question of when this is going to happen. And so we are very happy to bring this to you guys. We certainly understand how busy everyone is. People travel, but we know that you guys always want to get the updates on what's going on with the regional center, what's going on with DDS, our service system. And as you guys know, I also love to bounce ideas off of you guys and hear what's going on with the service providers too. I will also introduce Jennifer Bloom here as well, one of our other Associate Client Services Directors over children and our EI services primarily.
Good morning.
So, yeah, good morning. So we have a few different things we're going to go over today. I was meeting with Jean and Olivia this morning regarding a few different items. First thing I want to share is that just as it relates to our COVID numbers, we are still encountering ongoing cases of COVID. I unfortunately would have to report that we had another client that just passed away that we had to unfortunately report to DDS. And so it is, very serious. I think that is, 6 clients that we've lost since July 6th, which, and obviously we lost quite a bit more in the previous year before that, but it's been certainly a big challenge, and it's unfortunate that we're still in a position where we are reporting the passing of our clients related to COVID. With that being said, I know that we are sharing with folks, at least, that we are doing a booster clinic for COVID-19 at our regional center. We're going to be hosting one on Wednesday of next week for Alta staff. Oh, I will also introduce, there's Nicole as well. Good morning, Nicole, another one of our community services specialists. And so we'll be hosting a booster clinic ourselves. Certainly, I think there's some availability for Safeway if folks are interested in having a booster clinic, or we're doing ours combined with a flu shot clinic because you can administer them at the same time. And so we're just doing that at our office. If anyone is interested in trying to establish a contact with Safeway and you have not been able to do so, please reach out to me. Just send me an email saying I would like to get in touch with Safeway about it, a vaccine clinic, and I can get you set up with our partners that were so graciously shared with us by the STEP agency when, almost a year ago. It's crazy because I remember being on the phone with Jackie Foss on New Year's Eve and us talking about getting our first vaccine clinics set up with Safeway and really pushing towards trying to get vaccines done as early as possible for our clients. And so it's amazing. We're looking at, I think the first vaccine clinics at STEP were on January 22nd or so, around there. So it's been quite some time. Also, I would introduce and welcome Michelle Johnson, our Director of Client Services, that is with us also this morning. So one of the first things that I wanted to share, well, we're going to go over a few things. We're going to talk about the rate study. We already talked about COVID numbers a little bit. We've got the upcoming Disability Thrive training. We've got an upcoming training on self-determination for service providers coming up. We've got some discussions related to FHAs. We've got some new vendorizations to talk about, and some stuff about special incident reporting. So that's what we're going to cover in essence today here. And so one of the first things I want to bring up is discussion about the rate study. So over the last month or so, I've been talking with Olivia and Jean about doing trainings related to the rate study based off of the information that had been provided thus far by DDS. And we were, with relatively short notice, we were offered an opportunity, I think last week, to attend a training this week with DDS as regional center staff to go over what the rate study implementation is going to look like. And so with that, there was a training that was held. I think there was about 215 or so regional center staff from all over the state that were part of the training. And DDS director and deputy directors folks went over what the rate adjustment is going to look like. There was individuals from what used to be called Burns and Associates, which I believe is called the Health Management Assessment or something like that. They changed their names. Or they got bought up by a bigger company, I guess. But anyways, their rate study is going on, and there's lots of information that they provided in this training for us. So with that being said, Olivia and Jean and myself sat there with our eyeballs glued for 2 hours while DDS shared with us all of the details of this. And at the very end of the training, we all felt to ourselves, this is going to be quite a challenge for us to share with all of our service providers, because there's so many things that need to get done between now and when your guys' checks start increasing effective, April 1st. And so with that being said, we were very pleased to learn yesterday that the department has offered 3 training opportunities for service providers on this same topic. And so that Olivia and Jean and myself do not have to be the ones that do our very best to try to explain it to you, but instead, you will have the opportunity to be able to hear it directly from the Department of Developmental Services. And so with that said, I'm going to share my screen real quickly. And everyone surely should be seeing an email. Does that look about right? Yeah. All right. Thumbs up. Perfect. And so there are 3 different sessions that are available where you can register in advance. I would encourage everyone, if you are not signed up on DDS's website, in order to get these updates, it's really, really important that you do, so that you receive these when they come in. So again, there's,
John,
yep,
John,
yes.
we're seeing your regular email, not the
yeah,
DDS email.
I don't want
we're
that to
seeing-
happen.
No, but Dan's
All right,
been
let me see.
emailing you. We know that.
Oh, thank you, Dan. Dan's been emailing. All right, so let me try to share that one more time and see if it works this time.
It was your Avaya text.
There we go. How about that?
That's better.
That's better,
All right. John. There we go. Now we're looking at an email of mine. All right. So this is the upcoming rate adjustment, rate study implementation meetings that are going to be held November 9th, November 10th, November 15th. And you can see they have some different times that are available. Certainly know that it's difficult for service providers to be able to always attend at the same time. So with that being said, we are going to distribute this out to our service providers via email, and I certainly want to encourage folks to be able to do it themselves. I went on DDS's website to go see if I could see if they had posted this on their website, and I didn't see it anywhere on their website yet. Normally I try to take you guys there on their website, but it's not there. That being said, though, they have sent out a copy of their presentation. And so let's see, are we now seeing rate adjustment implementation? All right, very good, thank you. And so what I would encourage each of you to do is, first of all, I would encourage each of you to attend one of those 3 sessions as our service providers, but I also would encourage you to just take a look at some of these items that are on this presentation here and get a feel for what are the questions that you're going to want to ask to DDS specifically when you get that chance in those meetings. So they already kind of, again, did a dry run of the training with us, and we asked a bunch of questions. And again, it was DDS staff and then also the Burns and Associates staff. So there's a history of the discussion about the rate study, the components of the rate study. It talks about the implementation timeline for the rate study. So you can see here the time frames that are included in here. And then this was a standing question that folks had a lot, which was, are rate models going to be updated, or are we going to be working off of information from March of 2019? So what we did learn, and I certainly remember them discussing this, was that they will be updated before the rate adjustments occur. So those rates that were from that March 2019, again, that was a question I know Eric from UCP and others have asked about whether or not those are going to be. Oh, look at that. And meanwhile, Eric just emailed me about this exact subject. Good thing I'm not showing my email right now, like my other stuff. Oh, there's Eric right there. Look at that. So again, this is information that I would encourage you guys to just take a look at and review in advance of the public meetings that are going to be held for different service providers. Again, it goes over some things that we've seen before, which is an understanding of like how they're going to be looking at it. And for example, even information in here about when are we going to be doing things like changing service codes. We're not changing service codes for years. Like, we've got a ways to go before that's going to happen. And honestly, up until the very end, the existing service codes are still going to be in place. So again, there's information on how daily rates are going to be figured. Eric, I see your hand up. Yeah, go ahead.
So just a couple things. I don't want to get into it too much because DDS is going to be leading these webinars, and I want you to hear it directly from DDS. Yep. But maybe some folks are deciding if I need to be in these meetings and like how important these meetings are. So I got to talk with the department a little bit about this. There's a couple of key things. Those rate models are getting updated. So that, I think, is what you were saying earlier, John.
Yeah.
Some of us were skeptical that they would be doing a full update to the rate models with today's data. And we understand that that is happening, number one. So they will be updating, and that was part of our comments that we made to DDS, and they added that information into the presentation. So that is good. The second thing is just, you need to be aware there's basically a 4-year implementation plan with this. And it's not just increasing your rates. There's a lot of other things in the rate study that maybe is not happening this year, but it's part of a 4-year process. There are things that they have to do with migrating service codes. So some service codes need to, things change in order maybe what service code you're under and how you're vendored. It's not going to happen right away, but they're starting some of those assumptions now. So if you're in one of those categories, an 055, or a rate that's changing from a daily to an hourly rate or a ratioed rate, those are all things that you should be paying attention of now. It's not just an increase to your rate. There's other assumptions that they're going to start to make now. It may not take effect the first year. Most things that require other sort of changing, like training requirements, for example, that are assumed in the rate model. A lot of those other things you'll see take effect in years 2, 3, and 4. But they have to really organize this project to figure out what rate increase to give you in April. They have to figure out some of those things. So I think it's very important for all providers. I would recommend everybody register for that. I'll let the department go through their presentation. I think it's a good one on how this works, but it just so that the providers are aware, there's other details. You got to dust off that old rate study if you haven't already, and look at the assumptions also behind, so that you can make strategic planning decisions year 2 through 4. Okay, so I think for some folks they've oversimplified this and think this is about the dollars I'm going to get. That's true. You'll know your dollars now, and then you can extrapolate from there what your rate will increase over the next 4 years, right? You can see where the end goal is. But there's other assumptions that are going to be happening during this time that you may want to pay attention in, and some providers maybe more than others, about what assumptions and what improvements and system reform procedures that they're going to be implementing over the next 4 years. Okay. All right. That's all.
Excellent. Thank you very much, Eric. And again, some of those things that Eric just got done discussing were some of the areas that were addressed by DDS during this training that really would be best to listen specifically from them, so they explain to you all the different efforts that are going to be required in order for this to come out clean at the end, literally years from now, like several years from now. So I'm going to get back to sharing just real quickly, because again, I really want to encourage folks to participate in this type of meeting with DDS. We're talking about the future of the way a lot of these services are paid. And again, there are services here that are, ones that many of you provide. So I will also say real quickly, Johnny Zhang has also joined us on the third of our Associate Client Services Director. So good morning, Johnny, as well. And this next one just goes into the excluded services, probably a lot of these in Nicole's world that will not actually be receiving the rate increases, but some of those different ones. This is the one that we felt like is really important for our regional center, which is just what are we looking at time frame wise when it comes to this? We're going to be getting these reports that are going to be coming in. We're not going to get the rates until February 15th, and then it's rate increases, effective April 1st, which I would assume that you would see for the first time when you submit your billing at the beginning of May, you would see rate increases that went in place, effective April 1st. And so that is, I believe, that would be the way that would work out. So let me, sorry, I'm just going to minimize this again. Again, as Eric mentioned, they're going through and looking at all the different service codes. They're processing this information in batches. The outstanding items, this is another one that I think is very important for folks to be mindful of. Think about this stuff before you go to the meeting so you can ask your questions about it. So one thing talking about is how rates will, for new vendorizations will be set. These are things that DDS is still going to be working out with like stakeholder groups, things like that. How incentive payments will be considered in future rate adjustments. Timing of changes in unit types, because that's, looking at the moving hours to daily to hours, that type of thing. Defining programmatic requirements, including staff qualifications, and how hold harmless provisions will work. I mean, the hold harmless provision, I think for some folks, they just need to see what is the rate study finally going to say about what my service code is supposed to be at, and then we can determine the extent to which the hold harmless provisions are going to be involved. And again, the hold harmless provision is that in essence, over these years, while this rate study is going on, and there's incremental increases based on that, for those people that have rates that are above what the rate study is recommending for whatever their different type of services, then they will not be receiving any rate increases. And once the rate increase is, the rate study is fully implemented, then that hold harmless aspect would go away, and then those service providers would be rolled to whatever whatever the rate that everyone else is in essence held to. That being said, how that gets implemented, all of that stuff is aspects that GDS is still working on. And I think, again, we'll be doing it via stakeholder feedback as well. So then Burns & Associates did theirs. They are now part of Health Management Associates, and they do these rate studies all over the place. I was on the phone with my counterpart yesterday with the state of Nevada, and the state of Nevada did their rate study, and they did it with Burns & Associates. It just got completed. So, everyone uses these similar type of rate studies in different states. And again, talks about the data that was used in creating it, and that they're also going to be using some data all the way through June 30th of 2021. Again, they're going to go over through the process of how regional centers there's going to be a back and forth related to all of it. So again, I'm not going to go into all of the specifics related to it, but little things like this to be mindful of. So Burns sends the reports to the regional centers. We return the reports back to Burns. The calculated rate increase gets sent to the regional centers, and it gets sent to the providers. Then the providers will return it back to the regional centers, and then the calculated rate increase is sent to the vendor. So as you can see, there's a back and forth that's going to occur in a couple different areas to ensure that we have, fairness as it relates to this. Some of you guys are well aware that, like, for example, and I bring up like the 048 service code, like there is, I think there was like at one time 30 or 40 different subcodes underneath that one service code under 048. And there's no congruent meaning for any of the subcodes, meaning every subcode, like what one company defined that as a lead is not the same as a lead definition for another company. It's all completely different with all kinds of different payment rates. And so those are the type of things that a service provider might get caught up in, where there is a thought that your rate should be lower, maybe possibly than it should. And it's going to really require us, and I was talking again to Jean and to Olivia about it this morning, we're going to have our specialists look closely at every single one of those rates and make sure that it's fairly calculated for you guys. And if our specialists, so For some specialists, it's going to be really easy because it's going to be maybe a recent vendorization that we've done. But if it's something that's been like a while ago, we really are like at our regional center, we're going to look at having, instead of our accounting staff, like be the ones that are solely kind of looking at that stuff. We really want our specialists to get in there, take a look at the rates, make sure that there's no issues with them, and then also make sure that we are communicating and looking in the vendor files if we need to as well. So again, they did, I will say for our session, they did about a 45-minute long Q&A, I think, right? That was around that, Olivia and Jean, and I think that was very helpful. Thank you very much. Michelle just put the link. I'm going to click on it and make sure that she's not trying to give you guys all a virus on your computer. So it looks like it's safe. And so let me just share what, if you open up her link real quickly, folks, that's in the chat. It will allow you to click on, it looks like, to be able to register for these different events. Okay, and it looks like, there we go, under the upcoming events section on DDS, and it's got these public meetings. And let's see, how can we get there from the homepage? Oh, they just added this because this was not up like an hour or two ago, I swear. But anyways, there it is, right on the front page. Very good. So you guys can get in there. There was a discussion yesterday. We've got, sorry, I could probably stop sharing my screen real quick. We've got a number of folks here. What do we got? 62 folks. So we've got about 20 more folks here that were at our provider advisory committee yesterday. And there was a discussion related to the work groups that are going on. And I wonder if it would be a good idea to expand that discussion to this a little bit larger group, if anyone's willing to share kind of the discussion at the PAC meeting yesterday. I know I kind of started it off by saying that if folks are involved in any of these work groups that are going on with the Department of Developmental Services, that you, and especially if you're involved in any of the work groups related to, for example, the like the DSP language differential or the DSP training differential, some of those different policy areas. I'm very interested in you guys being really involved in those discussions, because the Department of Developmental Services is going to be trying to operationalize some things, and there's going to be some assumptions about how you guys gather and maintain like data, and how you can communicate back and forth with them related to like your HR issues, like with staff and things like that. So I just think it's important. So do I have anyone? I see Michelle talks about the quality incentive work group. Michelle, would you be willing to share just a little bit about what the work groups are? And then again, if we could just maybe echo some of the statements yesterday that were made related to the importance of them. And I'm going to share my screen while you're doing it real quick, just so I can show people what you're talking about there, Michelle, with that quality incentive work group. Oh, but you're muted. See if you're unmuted.
Sorry, can you hear me now?
You sound perfect. Thank you very much.
Yeah, so this group, you know, I haven't really dove into the topic yet, but we're going to be looking at the Welfare Institution Code 4519.10. I actually have that link. And we are going to be looking at outcomes and system. So as you know, our system is likely going to be changing to more of a value-based or outcomes-based system. And so this is just a preliminary work group to start to dive into what would that look like for our system. And so we're looking at quality outcomes, system efficiencies, equity, also, of course, the consumer experience and all of that. So that's just it in a very abbreviated version.
And real quickly, help me clarify. So some service providers may have been invited to participate in one of these work groups, but the work group meetings themselves are open public meetings? Question mark? I don't know that answer. Is that the way everyone's understanding is? That's
what I understand. It looks like if you go straight to the DDS website, there is, if you go down to the bottom, hold on, where did I go? So if you go over to upcoming, it shows all of the different meetings. And if you click on the quality incentive program, it looks like you can register to attend. So it looks like it's open.
Cool. So yeah, it looks like I could register to attend if I was available at that time. So yeah, again, I just, want to encourage folks because, the department is, I think it was just last week when I went over the trailer bill letter that was sent to the regional centers about how to implement it. And in that trailer bill, there was, the regional centers or the department will convene a stakeholder group to discuss this measure, or a stakeholder group for this one. So these are the stakeholder groups that are described in there. And as I mentioned, I would just encourage folks that really want to have an impactful opportunity to participate in these groups, and also to, if not participate in them, at least listen in on kind of what's going on. DDS has been very good about posting recordings of meetings that have occurred as well. And so again, because many of you have very, very, tight schedules that may not work for you, but you can always go back to DDS's website and see if they've got that. And they list a lot of the things under their initiatives. All right, unless there's anything else about that, I'm gonna move on to talk about the another upcoming opportunity, which is on November 10th. So I'm gonna share my screen. Hopefully share the right screen. So many of you, we've had the Disability Thrive folks come here, I think on more than one occasion to talk to this group, and certainly many folks are signed up to receive their emails that go out. So there is an upcoming training that is going to be available, if I can get it to open up here. And this is, free webinar, Alternative Services and Beyond, the Self-Determination Program. And this is a training that is also offered in Spanish as well. And so I believe we're going to be sending that one out to our folks soon too. So I want to make sure that folks are familiar with the Disability Thrive Initiative. You can go right to their website and see all of the excellent training opportunities that they have made available. Additionally, let's see, we have a training coming up. And I wonder if one of our associate client services directors might be able to share a little bit about this upcoming training that we have.
Hi, John, this is Jen. I'm happy to speak to this.
Thank you.
You're welcome. Okay, so the Self-Determination Advisory Committee put together an ad hoc group that's composed of SDAC members, Self-Determined Advisory Committee members, and regional center staff to put together a provider orientation about SDP. So really helping providers understand what may be asked of them by participants in the self-determination program or potential participants. So just really helping provide a general overview with an intent to really make this provider specific versus a general SDP orientation. So the intention is to give some basic information. We shared a copy of the PowerPoint presentation and a number of handouts, all electronically, to those who registered. We had 2 sessions this week, and it went very well, I would say. We had approximately, about 50 providers between the 2 sessions, and we have another session scheduled for November 16th from 3 to 4:30. One of the sessions was recorded this week and is posted, but I'm not remembering at the moment where it is posted. But Herman Kothi, our training manager, did record the training and posted it. We also have a post-session survey, like a poll, because we want to find out what providers would like to learn more about. And our intention is after that, the 3rd session on the 16th, we'll look at the poll, we'll determine what providers want to learn more about, and then we'll put together more specific focus-based lunch and learn type sessions to address those. There you go.
All right, any questions, folks? Did we have anyone from this group that attended the training?
I see
Yep.
people.
And it looks like Brianne put the link to the training. It's on YouTube. It looks like she put the link to the training. Yeah, thank you. I tried to, and obviously it didn't work.
Thank you
that
all.
is great. Yeah, that's great. So now we have the YouTube link on in our chat. Perfect. So again, we want to, anytime that we can get together a group of different people to develop training materials as opposed to just our staff, it's always so nice. And so having service providers, having, members of our community participate in the development of all of this, again, try to create a much better product for folks, things that are more meaningful. All right, I am going to now, let's see here. Wanted to share a little bit about we are continuing to monitor the challenges that folks are facing relating to resource development and, not resource development, I was saying, challenges related to retention of staff and recruitment of new staff, and also in the context of the vaccine mandate, and additionally the brand new OSHA guidelines that came out for folks as well. So I didn't get through all 300 pages yet of the OSHA guidelines. It seemed to, the Cal OSHA ones, it seemed to me that the fine looked very similar to the federal fine. I think the federal fine is $14,000 and the California state fine is like $13,500 something or something like that. But that being said, there is already obviously the mandate that exists through the California Department of Public Health and the Department of Developmental Services directive, and certainly from community care licensing for those of you that are licensed facilities. So with that in mind, we certainly are looking at what are ways that we can possibly look at dealing with emergency type situations that may occur related to lack of staffing for our clients. And so one of the things that we did is we did meet with one of our family home agencies, Enriching Lives, yesterday, and talked with them at length about different ideas that they have to help provide some relief on the kind of the residential side of things for folks that are continuing to deal with day programs that are being closed, and also continuing to deal with just the challenges related to losing in-person supports for our clients. So again, everything is kind of on the table right now. We're very open to looking at different ideas. Last year we dealt with surge type of situations with with a lot of our care home openings, but having more than just care home options is certainly a good idea, right? I mean, we should offer choices to people, even if people are in an emergency type of situation. And so certainly just, again, looking at some of the different ways that we can help support our clients as we have, whether it's a natural disaster / evacuation type of emergency, or just an emergency facing where we have a lack of staff that are able to provide, those supports to our clients in their homes. There was a spirited vaccine mandate discussion yesterday during our provider advisory committee, similar type of discussions that we've been having in this meeting as well. One of the things that was shared, and we've kind of talked about it a little bit here, was that there is an opportunity, it sounds like, that Jackie Foss is gathering along with the folks from CCLN, the California Community Living Network, to host a meeting with a employment attorney to ask questions for folks. And so Jackie made it clear yesterday that she certainly would open that up beyond just the provider advisory committee to our broader community of service providers that would be interested in having someone that they could maybe ask some questions to. And so we really appreciate that as well. We certainly want to reach out to those service providers beyond just our provider advisory committee when it comes to being able to provide some of those supports. And so what I would look at doing is that once we hear from CCLN that they're looking at hosting something, we would send it out via our MailChimp server to our folks that are signed up on our website so that we can get the word out there. None of these discussions are easy. None of the decisions that people make are easy. Everything impacts people's employment. Everything impacts everything else. Everything impacts our clients and the type of supports that they're going to end up happening. And we have had the discussions in here about the comfort level that clients have as it relates to our working with people that possibly are unvaccinated, and And also, again, the discussions about the liability that your company takes on with the, exemptions that are granted as well. So I think this will be, kind of a continued ongoing area of discussion. I don't know if anyone has anything further that they want to, this is a big group of providers, lots of regional center staff. If folks do have questions about either the regional center staff response to the vaccine mandate or, amongst yourselves, I'd be happy to open the floor now for anyone that might have any questions or comments related to that. Because I'm recording this video for YouTube, I suppose that I could just cut off the long silences when I ask questions and no one answers, and they could just like pretend that this meeting just flows regularly. No one will know because I'm going to be editing it, so who knows? So that being said, we have shared with folks about the survey that we've put together, and the survey is all done. It just needs to actually go out, and it did not end up going out yesterday. And I think I've got a staff person that can send it out in the office today. And so we're going to look at getting that one out. And then we're also sending out a complimentary email to our SLS providers with asking for a little bit more detail specifically from our supported living providers related to some of the challenges, or I guess really just their status as it relates to the vaccine mandate. All right, and one of the other things that I foresee going out, I believe, if I remember correctly, that we had Dan Kilmer mention, I think last time, or a few weeks ago, that we were working on housing access services. So we have now vendored housing access services. It's called First Step Housing Access Services. And so we have sent out an email this morning to our staff so that they are aware of this new service that has been vendored at our regional center. The expansion of housing access services to the different regional centers has been a priority area for the Land-Term Housing Alliance for the last 2 or 3 years. I have personally been a huge proponent of having these services at regional centers that can support clients in both their, finding their apartments, their housing, being able to maintain the housing that they're in. And so being able to bring that service to our regional center, we're certainly very pleased about that. And so for those of you that run supported living agencies as well, you will also be getting a copy of the email that went out to our staff about the new housing access services, because we certainly see the crossover between you as supported living agencies and the necessity to have clients that are, needing assistance in accessing their housing and maintaining their housing. Certainly, as always, the referrals will go through the planning team and the service coordinator, but we are, again, very excited to offer this. And this is kind of just there's so many components to the things that we're doing to try to address housing needs, and building housing is a really important thing. And at the Provider Advisory Committee meeting yesterday, I talked a lot about the efforts that we're making towards building new housing for people with developmental disabilities, but there's a lot more that can be done at like a local level, expanding to an even broader level with some of these other activities as well that really do make impacts in people's lives. Because trust me, if you're able to maintain that person in their housing, then that's one less person out there looking for affordable housing, and that should be certainly a goal for us. So we're very excited about that. Dan has taken on this project, and Patty Uplinger, who's been a very, very long time housing advocate in our area, has been hired by STEP to be their, housing guru. And STEP has already, I think, hired, we heard from Jackie yesterday that they hired their first housing specialist as well. So we're, again, very pleased with this. And certainly we've explained to folks as well that you do not need to be a client of the STEP agency in order to benefit from this service. This is a service that would be open up to every regional center client. And maybe something that we need to be talking about, Dan, for our transition age folks, right? Talking to Jennifer Bloom and saying, well, what discussions do we need to be having with clients and families as they're transitioning to adulthood, so that we can get, access to affordable housing for those people that want to live independently. So not just thinking about what, some people think of, which is, oh my gosh, this person's in and out of their housing and there's issues due to whatever reasons. There's also folks that this is a life that they want to choose for themselves, to be able to live out separately from their family members and not live in care homes and everything else. And if we can support those individuals to be able to get into housing that works for their, budgets that usually are pretty small, that can make a huge impact for folks. So there's again, you might envision some of these initiatives that we do look kind of like narrow, but really, it really tries to provide as much benefit to as broad a group of clients and families and everything else. So housing access services, again, very excited about that one and looking forward to them serving more and more of our folks in the near future.
Yeah, and John, if I can add for the for the future housing planning as well, our clients who are living with their aging loved ones, they can also be involved to kind of have those discussions with the client and their families about what the next steps are for housing. As their loved ones pass on. So to have housing access services in place at this point in time is critical to meet those future housing planning needs.
Absolutely, and the beauty of it is that we have Patty Uplinger as one of our members of our Coordinated Future Planning Task Force, and she is part of the subgroup that I believe Tracy Brown is leading, which is working on resources that can be provided to service coordinators in working with clients and families, talking about things like end-of-life planning, talking about things like accessing affordable housing, but literal tools. Like there's a lot of great tools that are out there, but we need to gather them together and we need to make them available and usable for our staff during the IPP meetings. And so that's kind of the charge of that group. And again, we're very pleased to have Patty being part of that right now. She's going to watch the recording of this at some point and be like, wow, they talked a lot about me during this meeting. Interesting. All right. I also want to, we also have a lot of folks that are always interested in the Meristem program and are interested in hearing about Meristem. And so we had a vendorization today that got announced as well. Olivia, do you want to just share that announcement that we had?
Sure. So previously, Meristem's ILS program only served individuals that were living in their dorms, and now it has been expanded to provide ILS services to individuals not living in their dorms. So we're excited about that.
Absolutely. There is always an opportunity to take a look closely at the services that you've created, and after a few years of operation, decide that you want to look at doing something a little bit different for this client population. And so it's not always the fastest process in the whole world, and we certainly take responsibility for those times when it gets delayed. But we want to support these, these opportunities, and anything that's going to end up with a better product for our clients at the end, more opportunities, more choices for them, is going to be where we're going to really promote our energy with our staff. So anyways, wanted to share that. We're going to have to figure out something else other than this last topic to end on, because I certainly do not want to just talk about the Office of Inspector General and be like, all right, have a great weekend, everyone. But I'm going to do that anyways. So, but I can edit the video. I could put this at the beginning of the meeting when I edit it later on for YouTube, and no one will know that I saved the worst for last. So real quickly, just want to share, if you guys are not aware, are we seeing a screen that says Office of Inspector General at the top? Surely, I don't know if I can trust you to say yes anymore because you led me astray earlier. All right. So Office of Inspector General, I do not think that every one of you is going to read the, I think it's 60-page long report, which I'll be honest with you, I didn't read either, but I did listen to it in my headphones because that's how I read these very long reports. So I'm going to drop this little guy in the chat for you, but I don't know, the title of the report kind of says it all. California did not fully comply with federal and state requirements for reporting and monitoring critical incidences involving Medicaid beneficiaries with developmental disabilities. So real quickly, I just copied that, and I am now going to paste it into the chat so that if you feel like you really want to take a look at this report, you certainly can. And the full report, there's actually a link to it at the bottom as well, so you could read the whole thing if you'd like. What they had some findings. So they made the findings that all what they call here critical incidences is what we call special incident reports. Critical incidents is like the federal terminology for it. So all critical incidents were, so basically the state of California. So they audit DDS in the state of California. They don't audit the regional centers per se, but in order to get to that information, of course, they had to come to the regional centers. And so the associate directors, myself, I think at the time, Jason Lindo was around working on this a bunch too. We had a very lengthy sessions with the Office of Inspector Generals, where they reviewed our special incident reports as well as a number of other regional centers. And again, there was two big findings here: that all critical incident reports were reported. They did not ensure that, and they did not ensure that critical incidents were reported in a timely manner and followed up on completely to ensure beneficiaries' health and safety. And California did not ensure that reported critical incidents involving the death of a beneficiary were properly reviewed. So what DDS what they recommended to the Department of Developmental Services, or I actually say to Health and Human Services Agency, I guess, is to provide additional guidance to providers, such as that includes the type of incidents that are required to be reported, and provide additional training to providers on critical incident identification and reporting. So if you work for like multiple regional centers, you may well be aware that regional centers use a different form from regional center to regional center. Our regional centers form was developed because it closely aligns with the data entry into our SANDA system, but that's not how everyone else has done it. So one thing that I could see would certainly be a challenge, let's say if I was on my own agency, is that I have one SIR form for North Bay Regional Center, and I have another SIR form for Alta California Regional Center. And typically you guys, even though you guys serve multiple regional centers, it's not like you guys have like a bunch of different training departments and stuff like that. So it can be a challenge, I think, for service providers having to have multiple different regional centers forms that they have to turn in. And then some of you might be aware that some providers choose to use their own forms. They choose to create their own SIR forms, and it felt like that was the way that it really needed to be. For years, DDS has talked about creating a system of data entry, like a portal where everything can go in uniformly across the state when it comes to support special incidences. I think that's certainly a good idea, and really in line with what you guys are seeing in the budget related to new utilization of technology to create like almost like a Kaiser type of app to be able to share information with clients and families. Like the more user-friendly we can make things for you guys and for the clients, that should be the goal. But having one set of statewide expectations that's in the California Welfare Institutions Code, and then having 21 different regional centers telling you how you should go about meeting those expectations based off of one set of reporting alignment project rules that came out 13 years ago that most regional center SIR folks are not familiar with. It's certainly a challenge for service providers. And so that would, how this will translate from the Department of Developmental Services is that there is more increased attention being shown to the special incidents that are coming in. And additionally, we've begun really looking closely at those Medi-Cal claims that are possibly indicative of some type of abuse or neglect of our clients. And Johnny and the ADs have been following up diligently with our service coordinators to figure out why those special incident reports were not made. And in some cases, it's because the service provider wasn't aware of it, and that's why there's like a hospital claim for an incident with our client. But in some cases, it's because special incident reporting didn't occur. So I say all of this in that the department is going to be continuing to focus on special incident reporting. If you think of the push that Dr. Ghali shared a couple years ago about data-driven decision-making and how that is going to kind of permeate its way through our system, I think like that is certainly in line with it when you look at some of the changes that we're going to be going through with special incident reporting. All right, and so I would ask, I don't know if there's any questions related to the OIG or the special incident reporting. Again, I think this is kind of a preview that in the next couple years, we're going to be looking at some changes likely to special incident reporting categories and things like that. I will say at our regional center, we are looking at ramping up with, for some of these additional requests that GDS has been making for special incidents by adding a new, it's basically another half-time. We had a half-time position that was working on SIRs in addition to our SIR desk folks, and we just increased it to a full position because there's just so much that DDS is requesting. And we know that you guys are getting contacted for a lot of follow-up information from our service coordinators as well. And again, DDS has really put a priority on making sure that we're following up on all of these incidences and getting that information back to them as quickly as possible. Any questions about this stuff? Anything that I missed? I don't know, Jean, Olivia, anything that I missed that we wanted to make sure that we would go over? Michelle, anything agency-wide that we need to talk about or promote or anything else that we missed?
No, John, I think we're good.
All right, excellent. Well then, as I've said before, you guys can reclaim 7 minutes of your life and have a great rest of your day. Have a great weekend, folks. And we will be doing Coffee with Community Services on next Friday. So though Thursday is a holiday for the Regional Center, we will be closed. I would love to just spend my Friday morning with you guys. So I will be there next Friday. If some of you are, some of you are. All right, have a great weekend, folks. Have a great day.